Okay, I don't know about you, but it was a little bit chilly and fall-like yesterday morning, and I caught myself putting on a pair of jeans. And whenever I make that transition from one season's clothes to the next, it feels a little bit different. And I found myself not liking so much the way that button buttoned on my jeans. And if you are beginning to think about losing the COVID-15, as they're calling it, maybe you added a few pounds to yourself over these quarantine weeks and you're looking to get in shape, perhaps we have help for you this morning. Dr. Shawn Jones joins us from Chattanooga Wellness. Good to see you.
Julie, it's great to see you too. I'm so happy to be on again.
I think it's true that a lot of us kind of have our comfort clothes, right? And the days of elastic pants can be very comfortable, but they can do you a world of harm. So you wanted to talk a little bit today about some of the things you offer at Chattanooga Wellness, including something called nutrition response therapy. What is that?
Yeah, absolutely. Can you turn the camera this way a little? So, nutrition response testing is a system of testing people so that we can actually have an answer for any health issues that you have. And so, the cool thing about it is we have test vials here from Standard Process. That's our staple supplement company we use because they're organic, whole food based. And the problem is that most people, when they are not feeling well, they take really too many supplements, because even taking things that are good for you, if you don't need them, can slow down the healing process. So we have a system using muscle testing and how the body responds to tell you exactly what you need and what you don't need to take to get a concise, affordable nutrition program to get you the results that you want.
Okay, so
it's called nutrition response testing.
So I think I jumped to the wrong conclusion then, because I know that so many times on the show you have very proudly chronicled your own weight loss journey. So when you were telling me about the nutrition response testing, I assumed it was weight loss related, but this is more health related. Is that right?
Right. A lot of people, if their thyroid is all out of whack, we have to get their thyroid balanced before they go into the Chirothin program that I lost 37 pounds on. And I'm in my second round now, so we'll see how much I lose in the second round. I'm excited to get back under 300. So that's a cool thing. There's a whole lot of buddy love to go around. But these people, when their thyroid is all out of balance, that's the master gland. We have to balance it. We have to go in and get things balanced, and then we can go into a weight loss program if that's an issue with somebody. Absolutely right.
So how does it work, the nutrition response testing? Is it kind of a...
Here, step in here, Carrie. I'll show you. So Carrie's going to turn this way. This is Carrie, one of my assistants here. Hold your arm straight out. We muscle test, and then we check, and we see how the body responds. Now, she's not blocked. When I put my hand over any body, or it's like belly button or the ear, she's blocked at the ear, but not the mouth. The body's not responding. So we call that nutrition response testing. So what we do is we grab the different supplements here that... Go hold that in your hand and hold hard. There. That supplement opens up the regulation. That means your body can heal itself. When you're blocked.
Okay, wait, Shawn.
When you have blocked regulation, your body can't fully heal itself.
Okay.
So the first step is to clear out all the blockings and what we call switchings, which are reversals in the body. And then we can get a true nutrition test to see what you need. And we like to keep down around 5 or 6 products, ideally, for people. They don't need to take 20, 30 products. They need to get the right ones and then eat better, because your food should be the #1 issue when you eat, is what is going to heal your body.
Okay, so Shawn, hold on a second. Go back to what you're doing with Carrie. You don't have to bring her in necessarily, but you can. So you were pulling on her arm or pushing on her arm, and it fell down.
We take a strong muscle, and if it's strong and we do only one thing, like we put a hand over body orifice, it creates an electromagnetic field. And we see how the body responds.
Okay, so you're saying by putting your hand over her nose, that does
over
something?
The mouth area, over her body orifice, the ear, the mouth, and the belly button. We want to make sure that the body's responding to the stimulus. If it's not responding, that means the body's not healing itself properly. And that's the first step in our nutrition response testing program. And then once we clear all that, we go in and see what supplements the body needs to actually heal the problem, and what's the #1 main organ. A lot of nutrition places give you 2 products for your thyroid, 2 products for your adrenal glands, 2 products for this and that. We don't do that. We find the one main organ that's under stress. We eliminate the stress nutritionally, and everything else balances. And that's how we know we've got the right program for you.
Okay, so then you took one of your supplements, I guess, and you put it in her hand, and you did that again. Why did you do that?
Omega-3 fatty acids.
So are you saying that just by holding that omega-3, that did something to help her?
Yeah, it's called energetic medicine. Everything has a vibrational field around it, a unique vibrational field, everything in the universe. So when we take pure products like this from Standard Process, we put it on your tummy. Normally you're laying down, but we're standing up here for the show. Then we see if it makes a change or not. If it makes a positive change, that's what we need to give you to help your body to heal. And then we also find out when you don't need it any longer and take you off of it. So that's what we do with our nutrition response testing. That's part of our chiropractic care that we do in the office here.
Okay, I have to ask you this before we move on, because I think a lot of people at home are probably wondering the same thing. So if you had that omega-3, if that's what you chose to offer somebody, they would take that. That would become internal. So how is it that by holding a bottle, that showed you something?
That's a great question. We have so many nerve fibers in our hands that if you put it in your hand, the brain gets a lot of neurofeedback from the vibrational medicine. This has to do with, there's a famous book out there by a famous neurologist or neurosurgeon called The Body Electric. Everything is electrical in the body. We used to put supplements under your tongue. Now all we have to do is set it on your tummy or have you hold it, and we can see how the body responds to it, because the brain knows if that's going to help it or not. And that's the whole principle of nutrition response testing.
Okay.
It's simple, it's affordable for people to be able to get better and help heal their problems. No matter what it is, we can help support the body. We don't treat any disease, just like with chiropractic. We want to give the body the nutritional support it needs to allow it to heal itself.
Okay, now something else you've shown before when you've been in studio about healing itself is your K laser. Are you still using that?
Oh yeah, I got my K laser right here. Oh yeah, this is my little beauty right here. My K laser is it's a wonderful little machine. It's a $30,000 laser. Even though it's little like this, it packs a wallop. And so what the K laser does is super heals tissue. You remember my twin brother, Dr. Mark, that was on last month? Before we did regenerative cell therapy with him, we used K laser when he cut his wrist severely and severed the nerves and arteries and the tendons. And in 10 days, he started moving his hand again. When the surgeon said it would be at least 5 or 6 months, he was moving it in 10 days. And it took about 8 or 10 months to get him fully healed so he could come back and practice. And then he had all these other problems that he had. And the regenerative cell therapy has made him feel fantastic. In fact, he'll probably come on again next month and talk about how he's doing.
So how do you use that, Shawn? How do you...
Yeah, great question. Yeah, with the K laser, even if you go in for surgery, after back surgery or any other kind of surgery, when you come out, we should laser the scar. If we do, it'll heal in a fraction of the time. So I wish surgeons would send people in just for laser treatments. They don't have to get chiropractic care after back surgery, obviously. But we can laser that scar, and the scar will heal up, it seals, and there's much less complications after surgeries. We use it for chronic, if you had surgery 20 years ago, it's still in pain, we can run laser over the area, and you can watch the pain reduce, because all laser does the same thing. It decreases pain, increases blood flow, and increases blood flow, but decreases swelling. Whereas if you use heat, it's going to increase swelling and decrease your blood flow, and that's why it supercharges your mitochondria of your cells. And what it does is it makes it super heal. And that's what's really cool about K laser. Any tissue can heal fast with laser ran on it.
So when you were talking about even if you had a surgery years ago, it can still be beneficial. You mentioned
absolutely. If you had joint replacements, we can run it over the area. If you've had surgery that didn't do well, you can run laser on it, and the surgery will do much better afterwards. Whether it's a new surgery or an old chronic problem, we have patients come in just for laser sometimes. Maybe they're not eligible for chiropractic care.
Okay.
And so we use the K laser a lot. It's a class 4 laser. But it's cold laser therapy, but it's class 4, which means we have to use eye protection when we run it, and we have to make sure we keep it in motion because it will create some heat due to the power. It's a very powerful 20-watt laser.
Okay,
which is really cool.
So let me ask you this. So it's beneficial, I think you said, for pain if you still have residual pain, but what if you just have the scar and you want cosmetically to make it go away?
Great question. When you have a scar, what happens is a scar is like a dam is to water. If it blocks electrical flow in the body, kind of like, like acupuncture has electrical flow. Well, when you have a scar, a surgical scar or some other kind of injury scar, we can laser that scar and the electrical flow won't be impeded any longer. You'll still see the scar usually. Sometimes the scars go away somewhat with laser treatment, but the important thing is the body can function normally again once you laser those scars. So if you've had a lot of scars, a lot of surgery, then the K laser works really well. And we have class 3 lasers too. That's what this is. Class 3, which you don't have to have. You can see it's lighting up there. Anything eye protection for this. However, when I adjust people as part of our chiropractic care, I use this laser to reset all your weak muscles, which is really cool. Part of the adjustment is I go through and I clear your spine. I'm from Palmer College. That's the oldest, largest, best school in the world. And I clear the spine like all chiropractors do. But then I go and I see, is there any weaknesses left in the body? And I reset it with a laser. Come here a second, Gary. I'll show you. This is really cool. When you have a weak muscle, put your deltoids. Her deltoids get weak a lot. There we go. Hold this right here. Hold hard. Now take your finger and touch right here. Here's the C5 nerve. It goes to the deltoid. Hold hard. Move down a little bit. Right here. Down here. Hold hard. There we go. So it gets strong right there. Drop this. Take your hand away. So I'm going to go up and I'm going to laser her for 2 or 3 seconds. It's all it takes to reset it, just like you reset your cell phone. You can reset your neurologic system. All right, there we go. Put your arms back up. Hold hard. See, now it's nice and strong. I may have blocked you there, but now the muscle's strong. You reset it. Thank you, Gary. So that's what we do as part of our adjustment and our protocol for chiropractic care. Is I go through and I check your muscles, I reset them. Whatever joints are bothering you, I check all those muscles around the hip, the shoulder, the knee, the ankles, whatever it is, and reset those muscles just like you reset your cell phone. You have to reboot it every 2 or 3 days.
Okay,
I have to remind my mama once a week, or she can't call out because the phone gets all messed up. She doesn't reboot it.
You made a reference earlier to your brother who was on the show with you last month, and he was talking about the benefits he has found of this regenerative cell therapy. You said you want to kind of tease ahead to something you're about to start carrying in the office. Is that right?
Yeah, absolutely. It's really cool. I know we're almost at the end here, but the regenerative cell therapy is something fantastic. You call our offices, the number will be at the end here at the 790-5000. And regenerative cell therapy, we do nutrition testing, we do the laser treatments on scars and on body. And if you're still having problems, the cool thing is we can do regenerative cell therapy. Now, they have a new product coming out now that is called Zombie Cells. One of the labs has come out with a product called Zombie Cells. It's amazing. I'm just getting information on it. So next month I'm going to tell you more about it. But it actually takes and makes your body heal even faster and can even extend the longevity of the body and your lifespan. And we're excited about this product coming out. These labs are state-of-the-art regenerative cell therapy labs that work with exosomes and stem cells and cytokines and all these products. And now they come out with something brand new that if you take this nutraceutical product while you're doing regenerative cell therapy, it just makes it even exponentially better, like K-Laser does when you're getting chiropractic care.
So for people who are seeing you for the first time, or perhaps they've seen you in the past, they want to make an appointment, do they need to know ahead of time, Shawn, what procedure they're interested in, or can they just call and say, my back hurts or my shoulder hurts or what have you, and you make the call once they're in the office?
Yeah, if they know they want chiropractic care, that's fine. But when they come in, first we do a history. And when I do the history, I see if they're a candidate for what type of services they need, and I make the recommendation. So if you're having shoulder pain, you may very well need chiropractic therapy. You may need some K-laser treatments. Or it may just be that the class 3 laser will set it and reset the function of the muscle. Okay. It all depends. So that's why we take a thorough history, we do an examination, and then we see, here's the recommendations I think we should do. And we have a coupon for only $99. You get 2 visits of any service you want, whether it's chiropractic care or K-laser. You can get 2 of any of those visits for $99. That's why you have so many neuropathy patients come in with foot pain and degeneration in their feet. They come in and try a couple of visits with us, and they're like, holy cow, your neuropathy program, it's a full program that encompasses everything, really works well. And
all
so
right.
we like to take care of those folks too.
All right, then let me give folks the way they can get in touch with you, Shawn, and thanks for your time this morning. 2 locations in Chattanooga on East Brainerd Road and in Cleveland up on Chambliss Avenue. The easiest thing is to go to their website, painreducing.com. Chattanooga Wellness is what you're looking up. We're back after
We
this.
appreciate you, Julie.
I'm a big bacon guy.
Big bacon boy.
Yeah, a big bacon boy.
Yeah.
That's great bacon.
It's good.